If you've ever wondered what mirror therapy is and how mirror therapy could benefit your stroke survivor in their own homes, then this video will have very definite beneficial information for you. Hi there, I'm Dr. Kenneth Monaghan. I'm a university lecturer, a neuroplasticity expert, and the author of Lights, Mirrors, Action, a guide for transforming the lives of caregivers and stroke survivors. I'm hugely passionate about trying to adapt a caregiver or stroke survivor's home as the best or ideal place for them to carry out their home rehabilitation after a stroke. So, you may or may not have heard of mirror therapy. I was very surprised recently when I was discussing with a Canadian family about mirror therapy, and they hadn't heard of this before. Mirror therapy is commonly used in Ireland. And mirror therapy originated because it started with for the use of phantom limb pain. So if I lost my arm in the morning, then there's probably a 95% chance that I will suffer from phantom limb pain. What happens is the brain is a little bit unable to understand why the messages, the normal information that comes from the limb that's lost is not still there, and it manifests itself as pain. And this Indian researcher back in the early 90s, Ramachandran, discovered or figured out that if you covered the limb that was missing, so the arm, if you covered it with a mirror so that we couldn't see the limb, and we watched, and if the patient watched an image, the image of the good arm, the limb that's still there moving, then it actually sent messages up to the brain and stimulated the brain in a way that made the pain go away. And it was an amazing discovery. And our Neuroplasticity Research Group, we, over the last 12 years, we've done numerous research projects that have um, investigated mirror therapy and found that the same principle seems to be very beneficial for stroke patients. So, if in the upper limb the patient cannot move the hands and covers it with a mirror, and you start moving the good hand and watching the reflection of it, it stimulates the brain in a certain way to make the hand start to recover movement. It's not a perfect treatment. It's not 100% successful, but there's overwhelming evidence, research evidence, that this works very well. And more importantly, it's a therapy that can be done very cost effectively at home because you can buy a $10, $15 mirror and very simply undertake this therapy. And in Lights, Mirrors, Actions, in chapter 15, we demonstrate an initial program that can be done for the upper limb, which you can carry out. Now, in terms of how you carry out mirror therapy, the technique is quite important, but it's very, very simple. And when the most important aspect is that when mirror therapy is being done, so when the person is moving the good hand or the non-affected limb, it's important that the stroke survivor watches the reflection of the good limb at all times. And this is very important. So, as a caregiver, what's important for you is that you're going to educate your stroke survivor about the fact that there's a thing called mirror therapy in the world. You're going to educate them about how it works, and you're going to educate them then about how to carry out this and how to get the maximum benefits from it. So the technique is very much that you must watch the reflection, and doing so is the point that stimulates the brain. Now, researchers worldwide would admit that nobody is 100% sure exactly how mirror therapy works and what exactly goes on in the brain. But with the advent of functional MRI scans, we can see that when a person is looking at the reflection of a limb in a mirror, the same brain areas are activated as when the person actually does movements without a mirror on that affected side. So we know that something is happening, and there are three proposed ways that this seems to work. And very quickly, the three ways are, the first thing that's suggested is that apparently we have mirror neurons or a mirror neuron system in our brains. And mirror neurons apparently exists so that when we watch somebody else doing an activity, our brains are very much activated to repeat that or to carry out that activity. I suppose a very simple example is if you ever see somebody trying to spoon feed a baby, how many times do you see them opening their own mouths at the same time as they're hoping that the baby opens theirs? And this is like mirror neurons in action. When we're watching a football game, I often, when the ball is crossed across the 6 yard box, how many times do you feel your leg almost twitching to try and kick the ball into the net? Because we're watching, it's almost stimulating us to try and carry out these activities. So it's felt that when these mirror neurons are activated through mirror therapy, that this has an influence on creating neuroplasticity. Second thing that's proposed is that even though we know different sides of the brain are responsible for different activities, and the example here is speech, which is controlled by the left side of our brain, electricity flows between both sides of the brain regardless of what activities we're doing. So when we do mirror therapy, even though we're using the right side of the body, the electricity will still be traveling between both sides. And it's felt that this electricity stimulates the damaged side or the dormant side and activates pathways through neuroplasticity as well, to give the person a better chance of recovering function. So mirror therapy very much excites the brain and kind of gets the brain excited so that probably for the rest of the day after a mirror therapy session, you're more likely to regain normal function when you try to do normal activities. That's my feeling and my beliefs over the last 15 years. The final thing is that from a sensory point of view, the sensory information that normally goes from your hands and from your limbs up to your brain, when that limb is covered by a mirror and you're looking at the reflection in the mirror, now extra visual information is taking place and visual information has been sent to your brain. And it's felt that that visual information, which supposedly travels faster to your brain, that visual information overrides the sensory information that is not coming correctly and not quick enough to the brain. And this has some effect on helping the brain to recover after a stroke. So the main message here is that from my experience, numerous people worldwide do not know that there's a therapy that exists called mirror therapy. Definitely don't know how mirror therapy works, what's the process for how it stimulates the brain. And as a caregiver, it's important that you educate, you inform your patients about this therapy. It can be done cost effectively at home with a very simple 10 to 15 dollars or euros mirror that you can purchase in any store. And in my opinion, it's definitely one of the therapies, one of the innovative therapies that's worth trying with your stroke survivors. If you'd like extra information and resources about how about this information and how to make sure that you can carry out this information and these therapies at home with your stroke survivor, then go to my website, which is www.lightsmirrorsaction.com, where you'll find some extra resources, some extra worksheets, extra videos that will be worth watching and will help you and give you more confidence as you're trying to organize your program. So thank you very, very much for listening.